Good afternoon, everyone. Welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette
Welcome everyone and welcome to this update on COVID-19 in New Brunswick. The government spokesperson today are Dr. Russell, the Chief Medical Officer, and the Premier Blaine Higgs.
Medical Officer of Health, Dr. Jennifer Russell, and Premier Blaine Higgs. We'll start today with Dr. Russell.
Good afternoon, everyone. Bonjour à tous.
Good afternoon, everyone.
The challenges presented by the COVID-19 outbreak and the burdens it is placing on our healthcare providers, the threat it is posing to people with underlying health conditions, and the fear and anxiety it is creating for families. But there is another threat we are facing, and that is we must really not become complacent. So we must continue to flatten the curve and protect those who are most in need of protection. Nous discutons beaucoup les
We talk a lot about the challenges presented by the COVID-19 outbreak, the burdens it is placing on our healthcare providers, the threat it is posing to people with underlying health conditions, the fear and anxiety it is creating for families. But there is another threat we are facing and must confront, the threat of complacency. We must continue to flatten the curve and protect those who are most in need of protection.
And constant vigilance by each and every New Brunswicker, no matter where you live in the province. We all must now more than ever maintain the practices that have been recommended by public health. If you can stay home to the greatest extent possible. When you must go out, keep your interactions brief and maintain that crucial 6 feet or 2 meters distance of physical distance between yourselves and others. Wash your hands regularly and thoroughly. Clean commonly touched surfaces like doorknobs and countertops. And if you have the common symptoms of COVID-19, isolate yourself and stay isolated for at least 14 days. Use the self-assessment tool online and contact your family physician for further advice and guidance, or call 811. Do not be lulled by a few days of modest increase in case numbers. We need everyone to stay on their guard and work together to get us through this pandemic. Today, there are 2 new confirmed cases to announce, an individual aged 60 to 69 in Zone 3 and an individual aged 20 to 29 in Zone 4. One case is travel-related and the other one is the contact of a case. This brings our total to 70 cases overall. Ne vous bercez pas d'illusions si
Do not be lulled by a few days of modest increase in case numbers. We need everyone to stay on their guard and work together to get us through this pandemic. Today, there are 2 new confirmed cases to announce. An individual aged 60 to 69 in Zone 3 and an individual aged 20 to 29 in Zone 4. One case is travel-related and the other one is a contact of a case. This brings our total to 70 cases overall.
42 are directly related to travel outside of New Brunswick, and 19 are close contacts of travel cases. There are 3 cases with no travel history or contacts with travelers, in other words, community transmission. And there are 6 cases which remain under investigation. I am pleased to report that 9 people who had COVID-19 have since recovered. Je suis heureuse de vous annoncer
I am pleased to report that 9 people who had COVID-19 have since recovered.
Transmission of COVID-19 in New Brunswick. This means we have to maintain our vigilance in limiting the spread of this disease. Toutefois, la transmission communautaire de la COVID-19
As we now have confirmed community transmission of COVID-19 in New Brunswick, this means we have to maintain our vigilance in limiting the spread of this disease.
for all the efforts that they have put in thus far to keep the numbers as low as they have been, and we would like to continue to see them stay low. When I talk about community transmission, people also want to know, well, what does that mean, and how should I be worried, and where is it exactly? And I guess what I have told people is to behave as if they already have COVID-19 and not be in a position of transmitting it to somebody else. And people are very worried and very concerned about what that means, whether you're a healthcare worker, whether you're a member of the public, whether you're an essential worker, frontline worker. Everybody wants to know what it really means and what they can do to protect themselves. So again, the issues and messages around staying at home are still very, very relevant and very, very important. And I know we all have somebody that we're thinking about in terms of protecting, in terms of a healthcare worker or somebody who works in essential service. We all know people who are out there working in these types of positions, and by staying home, we're protecting them as well as ourselves. And so again, I want to thank New Brunswickers for all the efforts that they have put in right now. And the fact that we are not seeing an increase right now in hospital admissions and ICU admissions related to COVID-19, this is a positive sign right now, but it also means that we have to continue the good work that we're doing right now collectively as an entire province. Why are we not providing specific community, gender, and age of the person who is infected? These are frequent media questions that I get, and people post about this on social media. There are several reasons around why we give certain information and why we don't, and the most important consideration is privacy. For example, in a small community or a village, providing that information could identify a person, so we've been very careful to protect that privacy and confidentiality. We've seen in other areas such as Nova Scotia when last week their Chief Medical Officer of Health came out asking people to not harass those who have tested positive on social media. I would hate to think that that was happening in our province. I think anybody who has been diagnosed, their confidentiality and their privacy must be respected, and whatever supports that we can provide to them, we should be providing to them. We should be able to encourage the people who have symptoms to be able to stay home and support them in staying home, as well as people who don't have symptoms right now, who are only going out to do essential necessities and picking up groceries. Everybody needs to be supported in the efforts right now that they are all contributing to. We do not want there to be a feeling that people who may have been infected may not be comfortable coming forward. We want everyone to feel comfortable coming forward with respect to the healthcare system and seeking out testing and seeking out care without fear of reprisal. While privacy laws are there for everyone's protection, the very valid reasons for not being that specific are far beyond that. If you are in a community that does not yet have an identified case, for some that provides a false sense of security, and I alluded to that yesterday. I don't want people to have a false sense of security. You cannot. Wherever you live in New Brunswick, you have to assume that there could be somebody who either has developed symptoms and hasn't had their diagnosis yet, or they haven't declared themselves yet with respect to their symptoms, and so we have to be very, very prudent around that. So if that person hasn't been identified, they probably are out there, and only by taking the precautions that we have in place right now and that we have advised so far can we reduce the spread. With that said, we are at the point that the number of cases is high enough, and we know they will continue to grow, that we can provide more data without risk of breaching someone's privacy. So that information will be coming forward, and we will get further enhanced as we move forward. So information like how many tests are done in each zone, what are the age ranges of people infected, and the gender breakdown, recoveries, hospitalizations, ICU admissions, etc. And unfortunately, most likely deaths. So we want you to be prepared for that information to be forthcoming on an ongoing basis. We will keep adding information and updating regularly in order to provide as much public information as we possibly can. However, I caution everyone that information is a snapshot in time. Continue to take all the precautions such as staying home, staying close to home, and keeping everyone safe. For those who are heeding the public health advice, I thank you. I realize that it can be challenging to maintain these practices. It may be helpful if we remind ourselves that why we are doing this and who we are doing it for. We're doing this for ourselves, of course. Nobody wants to become ill, but you can also consider the impact that your actions can have and will have on your fellow New Brunswickers. Perhaps you have a parent or an elderly family member who could be vulnerable to this disease. Do it for them. You may have a friend undergoing cancer treatment whose immune system is compromised and is at a greater risk of infection. Do it for them. You may have neighbors who are working in grocery stores or driving delivery trucks, working hard so that you can put food on your table. Do it for them. We appreciate how hard people in grocery stores, driving delivery trucks, and all the others who are doing essential work, we appreciate them so much and we thank you. You are making a difference by helping people every day. And the doctors, nurses, paramedics, and other valued healthcare workers who are putting their personnel health on the line every day to protect our health. Do it for them. The measures that have been recommended will only be effective so long as we all do them, constantly and consistently. We still have a way to go. We are only now beginning to see the impact of the actions that have been taken over the last 3 weeks. We will have good days, we will have bad days, but we can't lose our focus. Staying home will save lives. Our hospitals and the people who work in them are ready for what may come as the pandemic progresses, but they need your help. Les mesures recommandées ne conserveront.
These measures that have been recommended will only be effective so long as we all do them constantly and consistently. We still have a way to go. We are only now beginning to see the impact of the actions we have been taking over the last 3 weeks. We will have good days and also bad days, but we can't lose focus. Staying home will save lives. Our hospitals and the people who work in them are ready for what may come as the pandemic progresses, but they need your help.
Primary care, family doctors, and walk-in clinics have the ability to provide virtual care by telephone or other secure digital measures. Our regional health authorities are working collaboratively in their preparations, and we are partnering with the federal government so that we have the medical supplies we need when they are needed. Remember, your actions matter. What you do for yourself matters. What you do for others matters. Remember that you are not alone, and keep in mind who you are doing this for. Thank you very much. Merci.
Thank you.
Good afternoon. Bonjour. In the weeks ahead, we will continue to see an increase in cases of COVID-19 in communities throughout our province. To make sure we are ready and that our healthcare system has the ability to handle this strain, I've been involved in regular discussions with both of our province's regional health authorities. We are currently in the process of enhancing our pandemic operational plan. This plan will provide more details and guidance on how we will address increased cases going forward. The plan will be presented to the All-Party Cabinet Committee on COVID-19 as well as Cabinet for input. When it is approved, we will share our pandemic operational plan with the public. Nous sommes en train de renforcer.
We are currently in the process of enhancing our pandemic operational plan. This plan will provide more details and guidance about how we will address increased cases going forward. The plan will be presented to the All-Party Cabinet Committee on COVID-19, as well as Cabinet for input. When this plan is approved, we will share this pandemic operational plan with the public.
With the regional health authorities later today. I can tell you this plan takes both worst case and best case scenarios into account. This will allow us to prepare for any and all situations we may encounter as this pandemic continues. I am optimistic that if we continue to closely follow public health's direction and heed the lessons learned in other jurisdictions, New Brunswick will indeed be able to weather this crisis. Our province has a couple of advantages in slowing the spread of this illness. We are largely rural, with a population spread out over a large distance. And if we continue to practice physical distancing and staying inside as much as possible, we're in a good position to reduce the spread of the illness significantly. Stay at home and stay close to home as much as possible. By working together, we will indeed flatten the curve. Notre province.
Our province has a couple of advantages in slowing the spread of this illness. We are largely rural, with the population spread out over a large distance. If we continue to practice physical distancing and stay inside as much as possible, we are in a good position to reduce the spread of illness significantly. Stay at home and stay close to home as much as possible. By working together, we can flatten the curve.
From the early stages of this pandemic, by moving seniors receiving alternate levels of care in hospitals into nursing homes and long-term care homes. We have moved 115 seniors over the past few weeks, freeing up beds in hospitals across the province. We also canceled elective surgeries early on. Right now, our hospitals are at about 60% capacity, and we are in a good position to treat patients who require critical care. We are continuing to monitor the supply of testing equipment and personal protective equipment in our hospitals. As I mentioned the other day, we are working closely with the federal government. New Brunswick is part of a national procurement system that will provide supplies to provinces based on their needs. I want to thank the Prime Minister for putting this system in place and making sure all the provinces are working together to help one another as needed. That level of cooperation is crucial right now. I also want to thank the Prime Minister for taking quick action to provide funding for businesses of all sizes. I encourage New Brunswick business owners who have been impacted by the state of emergency to use the supports that have been put in place to help them through this difficult time. I want to encourage business owners to think long-term. Use this funding to stay afloat, but keep your employees working. Start looking to the future. Now is the time to be innovative. If your business is able to operate while continuing to obey the health standards that have been imposed, including physical distances, we need you. We will support you, and we encourage employees to do the same. We are all in this together and for the long term. I know many companies and individuals have stepped up in the past few weeks to support food banks, soup kitchens, and other charitable organizations. I want to thank the people and the organizations who are doing what they can to help those in need. The generosity of New Brunswickers always comes through in times of crisis. We need to continue to know that sense of kindness and empathy, and we need to continue to show it and continue. Je sais qu'il y a plusieurs.
I know many companies and individuals have stepped up in the past few weeks to support food banks, soup kitchens, and other charitable organizations. I want to thank the people and organizations who are doing what they can to help those in need. The generosity of New Brunswickers always comes out during times like these. We need to continue to show that sense of kindness and empathy.
Workers' Emergency Income Benefit. This $900 benefit is intended to bridge the gap until federal EI benefits are available. We have already received more than 38,000 applications, which shows how important this program is for workers and self-employed people who have lost their jobs due to the state of emergency. We will begin making payments to eligible recipients later this week. I know there have been a lot of questions from parents and students about how this situation will impact the rest of the school year. I want to assure you that the Department of Education and Early Childhood Development has been working hard and is in the process of finalizing continuity of learning plans and supporting resources to address these concerns. We will have more details on this in the coming days. I want to thank all New Brunswickers for your support and your resilience and your patience. We cannot do this alone. Je vous remercie tous les gens.
I would like to thank all New Brunswickers for your support and your resilience. We can't do this alone.
To do what you need to do to keep us safe. We need your part. You need to play your part in flattening the curve. Thank you. Merci.
Thank you.
Thank you, Premier. We will now proceed with questions from the media. Nous allons maintenant procéder aux questions des journalistes.
Yeah, we will now move on to media questions.
Follow-up, and you're invited to ask your question in the official language of your choice. Chaque journaliste aura...
Every reporter will have one question and one follow-up, and you can ask your questions in the official language of your choice.
Brown, CTV News.
Hi, Premier. I'm wondering if you can tell us at this point, both PEI and Nova Scotia have put a date on when schools will be closed until, and then of course reevaluate at a later time, but until at least May. Do you have an idea for New Brunswick schools at this point?
I don't have an exact date at this point, but we do intend to roll out the education plan in the either later this week or early next week. And in that process, we'll define what our anticipated date would be, but I would say it's fair to say it likely will be in line with the other provinces.
Did you have a follow-up, Laura?
Yeah, so I also had a question about the idea of certain people not putting their addresses or their addresses not being legible. So yesterday when we were talking about testing and testing in certain zones, there's certain people that couldn't be counted in those zones because their addresses weren't either legible or added. Can you explain a little bit more about that? I believe that probably is a question for Dr. Russell.
Yeah, hi Laura. How are you doing?
Good, how are you?
Good. So yes, there was an issue around the postal codes. So what we've done now, moving forward, is we're capturing the data based on where the actual test was done, not based on the postal code of the patient. So
Great, thank you.
that accounted for that discrepancy.
Thank you. Jordan Gill, CBC.
Yes, this question's for the Premier. Premier Higgs, does the province have any plans to shut down construction or stop subcontractors moving between job sites? Since safety requirements often demand these workers pair up in certain situations.
Certainly, if they cannot follow the rules, the safe distancing rules as we put in place, and they are not to be performing their duties as they normally would. So if they're violating those rules, we will need to shut them down.
Do you have a follow-up, Jordan?
Yes, I do. Yesterday, Dr. Russell, I guess you said it's important for people's physical and mental health to get outside and go for walks. And most municipal parks are still open. If people are maintaining the recommended 6 feet distance, what concerns do you have about the parks remaining open?
Well, I think the main concern is around people congregating, and while we do have the messaging around not doing that, I think there have been instances where that has happened. So I think walking in the areas that you can in terms of sidewalks and trails around your house is really the best case scenario at this point in time. But I hear what you're saying, and I can understand where you're coming from.
Silas Brown, Global News.
Hi there. I'm actually not sure which one of you can answer this, but I'm curious when the Premier talks about the pandemic plan that's being done, or updated, I should say, with the health authorities, and I know Dr. Russell yesterday during a technical briefing you mentioned that we should get some modeling as early as tomorrow. Are those two separate things, or are those kind of the same? Is there a pandemic plan and modeling that will come from public health, or is it a combined thing?
It's a combined thing. I think there are many pieces of work that were done separately that are now being consolidated. So it's quite a good approach in terms of what we know as a province. So each individual health authority was working on some pieces of work that now we've been able to consolidate to be able to put forward sort of what the New Brunswick plan is based on modeling, but based on pre-existing plans. So combining all that information together based on that that's what, and it won't. I thought it was going to be tomorrow, but it's actually going to be Thursday, Silas.
And did you have a follow-up, Silas?
Yeah, I'm wondering if you could give us kind of a preview of what sort of information is going to be included in that.
Well, if you look at the BC data that came out last Friday, it will be very similar to that.
Michel Corriveau, Radio-Canada.
Oui, bonjour.
Yes, hello. This is a question for Dr. Russell. Dr. Russell, earlier you mentioned that we need to keep working and that we already see the impacts of the measures that were established. Could you elaborate on this, and what do you project for the near future? So regarding the results that we got so far, regarding our current cases, so the number is at 70, we could say that we will probably see a number of increase in cases and more hospitalizations over the next few weeks. And when this happens, we will reveal some information about those new cases. But our approach regarding measures that were established 3 weeks ago, I could say that it's a success at this point, but it doesn't mean that we should stop these measures. We should keep taking these measures. It's difficult to predict an increase in numbers or what will be the exact numbers, but to make sure that we can protect our healthcare system, this is why we need to keep taking these current measures. Do you have a follow-up question? Yes. So, Dr. Russell, everyone is talking about flattening the curve. So, what is the current situation on this? Is the curve flattened, or we are still not able to say this? So because we implemented measures early on, it's difficult to say at this point, but the information that will be presented on Thursday regarding regional health networks preparation, these are based on models to see what type of numbers we could see in New Brunswick. So this was calculated, and we will be able to present this on Thursday.
Hi, Premier, I'd like to talk about the pandemic, or ask about the pandemic plan for a minute. You said it's going to go to the all-party cabinet committee and to cabinet. Does anybody have a say in that plan? Like, if somebody doesn't like that plan, can they say, no, let's not do that? Or were they all heavily involved in this, and it's more just rubber stamping the final plan?
Well, at this point, it's been the health authorities and the health department working with public health to determine, what would be an effective plan for the province. So that is the first phase, and then that's presented to us. I've been working with them the last day and with the Minister of Health just on my concerns or questions, and basically, it's looking at some of the scenarios we've seen in other countries. It's looking at where what our trends would be, worst case, best case, what our capabilities are in our hospitals, particularly with the number of patients or long-term care patients we've moved out, and also what we've changed for elective surgeries. We're seeing about a 40% vacancy across the province. We're seeing we're prepared. It's defining the level of preparedness that we have. It's presenting all these facts to us, as well as the condition of our supplies and our backup for supplies, and we want where triggers are that we need to act. Let's say put new measures in place. We want to ensure that each hospital that's been designated as a COVID hospital has the capabilities that they're putting forward, and what the protocol is. So, in saying all that, a long-winded way to say, this information is then presented to our COVID committee and my colleagues, and then they go through the details of what is being proposed, what questions they may have, what other ideas they may have. That then will be considered by the Department of Health and the regional health authorities and public health as okay. Is there something more we need to add? And then on Thursday, it'll be presented to my cabinet. And then it gets kind of there, so there it gets input as well. And then it'll be presented, as Dr. Russell said, either Thursday afternoon or maybe on Friday. But there's a lot of checks and balances through this. But of course, the most important ones are the checks and balances with the medical professionals in the field, all throughout the province, who are part of turning what the best ideas are that they generate into reality.
And did you have a follow-up, Andrew?
I do, thank you. Again, to the Premier. So the Prime Minister says that 24,000 members of the armed forces are on standby. Obviously, Gagetown's a very big part of that. Is bringing in the military potentially part of that plan? Is that an option that will be in that document?
Well, at this stage, it isn't an option that I have seen in the presentation that I've seen to date. However, there is a full document that we will review more detail on it tonight. I have had a discussion with the base commander here locally and about their state of readiness. We have engaged EMO, as you know, which certainly are planning this across the province and what it might mean to them in our kind of normal process of planning for emergencies. This one is different. It is unique in that regard. So it's nice to know that everyone's on alert. I think it's very important, and that's why I made that call. But do I see the need at this stage and the foreseeable future? No, I won't say as I do. But are we going to identify the triggers and the time and consequent or the situation that may require that? We would want to make that part of our plan.
Mathieu Roy-Como, l'Acadie Nouvelle.
Bonjour, ma question est
Hello, my question is for Dr. Jennifer Russell. Now that we have the number of cases per region, they are people in the northwestern area that are still worried. They are concerned about the number of tests in those regions. So what is your message to those people? Well, I have 2 points to make on this topic. I received information from my colleagues in this area. And they believe that one issue is that people do not want to be tested. So they didn't call 811. So for those individuals who have concerns regarding tests, I would like to encourage them to call 811. I would like to encourage them to call their family doctors as well. You can receive virtual care now. So one of my suggestions on this topic is regarding capacity. And regarding the tests that were already conducted, there was never an issue with demand. So we still have the capacity to conduct those tests. So I encourage you to call 811 so that you can get those screening tests. And if you have any concerns regarding community transmission, yes, the numbers are still low right now. We cannot predict what will be the future increase, but if everyone stays at home, as recommended, we will try to keep those numbers as low as possible. And when we have more information, we will share it. And also, when we see the number of individuals who are not hospitalized, that's also an indicator that the issue is not so serious at this point, but it's very important to get ready in case there's an increase. And maybe our healthcare resources will be used more and more to deal with those issues. So we need to have a plan in place. That's very important. That's why we will reveal this information Thursday or Friday about the preparedness plan of both health networks. Do you have a follow-up question, Mathieu? Yes, thank you. Dr. Russell, so correct me if my numbers are wrong, but we now have the capacity of doing 1,000 tests a day at the Georges Dumont Hospital. I'm not sure that we're doing 1,000 tests per day, so why are we not testing 1,000 individuals per day? Well, the demand is not necessarily there. If you call 811, if you go see your family doctor, if you need a screening test, resources are available to conduct those tests. So the capacity is there. If the demand is not there, well, I don't have major concerns about this, except if there are people who do not use those services for a reason or another, and the screening tests that were already conducted in hospitals or in emergency rooms, we are still not seeing positive results for those places, but we give the priority to healthcare workers who did not travel, people who live in institutions or where an outbreak would be very dangerous at this point. So we are giving the priority to those individuals for now. So when people will need those screening tests, the resources are there. Vicki Hogarth.
Thanks, Dave. My first question is for the Premier. I'm hearing stories directly from people who work in essential services who are being denied entry into stores when they've been asked what it is they do for a living and where they've been. Is it fair at this point for essential service workers, be they a doctor or a trucker, to be denied entry into stores when they're off duty?
If I understand the question correctly, if the store is open as part of a, allowance and following the health and safety rules, then I'm not sure why anyone would be denied entry. So you're saying an essential service worker is denied entry?
Mm-hmm. Based on what they do for a living and the chances of them possibly being exposed.
Well, I guess that's disappointing in that sense because, we are protecting, these workers are being protected in their daily activity and what they do. So although we expect all of them to limit their exposure when they finish work to go home, but we recognize they have a need like everyone else to go to a facility to get supplies, and they should be allowed to do that.
Do you have a follow-up, Vicki?
Yes, on the flip side, there are still some stores that are experiencing high volumes of customers shopping at once, often in pairs and in groups. And at this point, can you put a limit on the number of people that are allowed in a store based on its size, as well as a ban on unnecessary shopping in groups?
Yes, we can, but we are expecting the actual store operators, managers, owners to do just that. So, and I've heard the same stories that you'd say where 4 or 5 people go in and they come out with one bag that collectively, and you're kind of say, well, why did it take 4 people to do that? So I agree completely, but I would expect a store manager to limit that, and we know that some facilities are doing that. We know that's being done in like MV Liquor. It's being done at the larger retail outlets, like I think all of them really, the grocery chains, that are saying, the people are lined up outside. They're only being allowed in sections. They're marked off where they can go, and so I would expect the managers themselves at that facility to indicate and limit the numbers that can access at any one time and how they access.
Thank you. Elizabeth Fraser, CBC.
Hi, my question is for the Premier. So you said yesterday that parks are closed, and I know that's true for provincial parks and national parks, but most municipal parks are actually still open. This seems to be causing some confusion for citizens and municipal leaders. Will you be directing the municipalities to close these parks at all in the future?
Well, I think in the case of our general direction about parks, we do not want to keep any places open that would cause let's say a gathering to take place. And I would expect municipalities to follow that same protocol as we're following here. So I know that there are spaces where people like to go, and many of these things come right down just to common sense, that there are open spaces in New Brunswick. That's one of the advantages of living in New Brunswick. So you can take advantage of those without all going to one spot to be together. So yes, I would expect municipalities to follow the same protocol that we're following provincially, and I would also expect individuals to decide where they can go and be, let's say, out in the fresh air without exposing themselves unnecessarily to others.
And do you have a follow-up, Elizabeth?
Yes, I do. Again, this is a question for the Premier. It's been announced that Irving Oil is going to help out by making hand sanitizer. What can you tell us about that, and what potential do you see for industries in the province to retool to deal with shortages needed to fight COVID-19?
Well, I'm certainly pleased to hear about any business or individual that's able to help offset some of our supply needs, and hand sanitizer is certainly one of them. And I think there are a couple companies in the province that are looking at doing that and are ramping up to do that, and we're certainly pleased to hear it. I also think there's others that are ramping up to make gowns or other some necessities that we need. We have a kind of a supply list that our purchasing department have put forward. This would be similar to what we put forward nationally, but the more we can make locally and provide locally, certainly the quicker access we have. I know I mentioned a few days ago or last week about Ontario, and a lot of their auto sector is ramping up to make things like ventilators, and where their businesses allow it, plexiglass, isolation cubicles that give people protection in the retail outlets. So the more that people can be innovative and provide protection to ensure people have isolation and can maintain the safety, hygiene and standards, the better it is. And I commend the companies, not only ones that are moving forward in terms of equipment, but moving forward and donating to food banks and shelters and stepping up in a big way to help our province at a time of need.
That concludes today's update. Thank you very much. Voilà qui met fin à notre
This concludes today's update. Thank you.